I want to bring in our senior medical correspondent, Elizabeth Cohen. Elizabeth, what are the symptoms of MERS and what is the risk to Americans?
You know, the symptoms actually start out as symptoms that are very common to lots of illnesses, like a cough or chills or a fever, but then it can progress. And when it gets bad quickly. Jake, you know, the mortality rate for this illness is 30%. That is very high. That's the bad news. The good news, you asked, should we be worried? You know, if I was the wife of one of these patients, or the husband of one of these patients, I would be worried. If I was their doctor or nurse, I'd be worried. But this disease does not spread easily. So basically, if you're sort of not part of that inner circle, you really do not have a high chance of getting this illness.
Well, that's good to know, because this Florida patient, we've been told, flew on 4 different flights. You're saying that those passengers should not necessarily be worried. Is that right?
You know, the CDC says that out of an abundance of caution, they're going to contact folks who are on these flights. So this passenger went from Jeddah to London to Boston to Atlanta to Orlando, Florida. So, you know, that's a lot of people. The CDC is trying to contact more than 500 people who were just on the domestic flights alone. You know, they can't really say whether this disease spreads easily in a plane, you know, situation. They just don't know because it's so new. But really what they've seen is they've seen it spread when it's people living together day after day, or people who are in a hospital setting together day after day.
And Elizabeth, do we know of any possible connection yet between the Indiana case and the Florida case?
You know, there doesn't seem to be a connection. It seems to be that these were 2 healthcare workers working in Saudi Arabia. One flew to Indiana, another flew to visit family in Orlando. There doesn't necessarily seem to be a connection.
Elizabeth Cohen, thank you.